Hello.
G'day, g'day.
Let me just close the window. We've got rather a chilly breeze coming in here. Give me a minute. There we are. So, how are you?
I'm well. I'm surprised at your news, but I think I'm well.
Yes, I'm well too. Yeah. Although I think there's some doctors around me that don't think I'm well.
Well, that was a bit of a shock, wasn't it?
Yeah, well, I wanted a diagnosis, as that was my, I had, as you well aware, I had calf pains now for many months, and I tried different things, didn't quite understand it, did lots of research, and didn't understand quite what was causing this pain in my calf muscles. I couldn't walk sort of 50 meters without having to stop and take the weight, particularly off my right leg, which was always the first of the legs to stop working. Okay. And I just couldn't get to the bottom of it. Okay. So you would search for things like painful calves, okay, and you'd get a list of all sorts of things from all sorts of directions and all sorts of opinions, and some of them I tried and worked with, and some said rest the calves, some said massage the calves, some said exercise the calves, but of course, anything I researched couldn't give me a diagnosis because it just can't. So I thought, okay, I must go and get a diagnosis. I want a diagnosis because I can't carry on my life without going for a walk. Okay, and why should I? And I wanted to find out. Once I had a diagnosis, then I would then have, the ability to sort out how to deal with the diagnosis. Okay, so anyway, my daughter suggested I go to an osteopath, and that didn't work out. Okay. I paid her big fee, and then she sent me away. She said, out of her domain, I must go to a GP. Okay, so I nearly said to her, "Well, must I still pay you?" Okay, I mean, you haven't helped me at all. You're sending me to somebody else. Okay. But I didn't say that, okay. And I paid. And I went to the GP, and the GP sent me for blood tests and sent me for a scan. Okay, so went for the blood test. Then I had to have another appointment, so I paid the GP a second time to tell me what the blood test results were. Okay. And then I went off for the scan, and that was on, when was that? That was Friday afternoon, Friday 1 o'clock, in fact, that's right. Friday 1 o'clock, I went for the scan, and it was an ultrasound scan. So he spent an hour prodding me with ultrasound, just my legs, from my groin down to my feet, and he had a big screen up in the wall, and wherever the ultrasound was going, I could see what he was doing. on the wall, which was quite interesting, because I personally had never had an ultrasound before. And, so I could see the veins, and I could see the arteries, and I could see, you know, he would like miss a beat every now and again. So, you know, I guess he, you know, he got a bit surprised that some of the arteries, you know, the one artery was from my groin to my knee was blocked. Okay.
Completely.
Yeah. Okay. Then there were other arteries that were partially blocked, and you could see the narrowing, okay, in the ultrasound and so on. And then, you know, on the veins side that are coming up from the bottom of the leg, then, you know, a lot of them were blocked as well. And so at the end of the scan, and as I said, it was an hour, so it was about 2 o'clock on Saturday. He said, please go and wait he's going to phone my GP. Okay. And he phoned my GP, and they clearly had quite a lengthy discussion. And then he came back to me, and he said to me, I've spoken to your doctor, and we both want you to go to emergency hospital right now. Okay, right now. So I said, okay, that's fine. And he told me why. He told me about the blockages and so on. He said his concern was the veins, you know, which are coming up towards the heart, okay, rather than the arteries, which seem to be, to my observation, you know, but the arteries are so much bigger, so it's easier for a layman to see a picture of something that's big than the veins. But he seemed to think the veins were going to be the issue, and he said, just go to the nearest hospital. Okay. And because he was quite a distance from the home. It took about half an hour drive to get to him. And Sue had driven me, because obviously with pains in my car, it's not easy to drive, and it's painful to drive as well. So she very kindly, you know, took me. And when I got out of the car, told her that, she had been in the meantime for the hour plus, it's probably an hour, 20 minutes or so. She had taken a laptop with her and was working in the car, and like accidentally, she must have left the keys on to open the window or something. Okay. And the battery was flat, so we couldn't get started. So anyway, we got some help, and we went off to the public hospital. So we were aware of the name. We didn't know quite where it was, but we were aware of the name. So we went there. And before they allow you into the hospital, there's a big tent outside. Anybody who's going to go into emergency in the hospital has to have a COVID test, you see. So I had a COVID test, a long queue waiting. Everything about the hospital, it was waiting, you know, everything.
Slow. No.
Hey, it's waiting. Anyway, I tested negative, so they then took me through. And I said, what would have happened if I tested positive? That we would have taken you somewhere else. They didn't say where. Okay. I said, well, fine. Okay. I'm negative. So yeah, so they took me into the emergency, waited there with Sue. Sue was allowed to come and sit with me. And then a nurse came along and said, you know, what's be better for you to come to the clinic, the emergency clinic. So, traipsing through the hospital, up and down lifts and things, and we land up at the emergency clinic, okay, along with lots of other people, okay, in the clinic. And the wait starts again. But anyway, let me not take you through all that. It's just one thing I learned about Australian public health. They might be very efficient and might have good instruments and things like that, or tools, but they're very casual about time and how much time they take. But that really, I got to understand that after a few conversations. I mean, there were people that, now Sue wasn't allowed to come into the building. She had to sit outside the building, along with other people who had people inside the building. And some of those people had been sitting there for 6 hours waiting for some communication. Okay. And that was some of them. I mean, one said had arrived at 8 o'clock in the morning, and this was now about 2:30 in the afternoon, and they were still waiting. Okay. So anyway, the bottom line is I had to encourage them to, they didn't ask me. I had to encourage them to say, listen, I've been for blood tests, I've been for scans. Oh, have you? Oh, then maybe that'll be quicker for you then. Okay, because they were going to send me for blood tests, they were going to send me for scans. And I said, but I'm here in the direction of a doctor. Surely, which doctor was it? And they phoned the doctor, and they said, we want a copy of the blood tests. And so they scanned it through and from the doctor, and then they phoned the radiologist, and the radiologist uploaded the scan and the explanation and so on to somewhere where they could download it, which anyway, they did that, and they understood why I was in emergency now. Okay, up to that point, I was just another person who'd walked into emergency. They didn't question me or quiz me. I'd probably just come from home and decided to go to emergency or something. But now they had something to go on, and so yeah, they still sent me for another ultrasound scan, and because they called it a confirmation scan. Okay. So, and they just wanted one section, and that really the right leg that causing the most pain, and obviously causing the most problems from the previous scan. And so a very nice fellow who did the scan in the hospital, he said, I confirm exactly what the other person found. In fact, I think it's a bit worse than what the other person found. Okay. And so his equipment did appear to be a little bit more sophisticated than the one I went to before. I don't know, maybe he just does pregnant women or something in the other one, but who knows. But the hospital seemed to have good equipment. So they confirmed that was an issue. But now they wanted a CT scan. Okay. Now that's radiation, as you know. Okay. So fine. Okay. I said, because me and my why. Okay, why must I do a CT scan? Okay, you've got now 2 ultrasounds, and they both confirm each other. No, they gave some weak. It really wasn't a reason, but it was. We need some other sort of confirmation. Okay, whatever it is, and. So they take me, and between each one of everything, from arriving and waiting for somebody to say hello to me, to getting onto a bed, waiting for somebody to come and do some tests and take my blood pressure and all the other things. It's all long waits. So we're into the evening now. Okay. And so they take me through, and I wait for the CT scan. But they had prepped me for the CT scan beforehand, up when I was in the arrivals of the emergency. Okay, once they'd seen everything, and they said, right, we want you to have a confirmation, and want you to go have a CT scan. Of course, with a CT scan, they inject dye into your vein so they can follow it or something. Okay, and so they prepare you. So they put a needle into your elbow, behind your elbow, and but they couldn't find my vein. The first doctor tried 3 times on my right side. That's 3 different pricks and pricks. Okay, and not with a normal thin, like you extract blood. This is a much thicker thing because they've got to pump something in. Okay, they couldn't do it. The doctor then went to the other side, the left side. He tried there, and he couldn't find the vein again. Okay, meantime, I'm the one that's bloody got pain for all these pricks. And the nurse said, let me do it. And she came around, and she tried, and she couldn't get the vein. Okay, so then they had to call in a senior doctor, another doctor. The one was a doctor, but somebody higher in the hierarchy, and he came, and he put it in, and apparently he found the vein, and he drew some blood, and he said, okay, it's all ready to go. Okay, so okay, now this is the 4th one in my right arm. Okay, 4th hole. And so anyway, now I'm waiting for the CT scan with this thing in my arm, and get onto the CT scan bed and so on. And they do all sorts of preliminary tests and planning, pushing me in and out to get some sort of focus and get things all lined up or something, whatever they do. And then they came to me and said, right, we're now going to start injecting you with the substance. Okay, so and they give me all sorts of things about what might happen. I might get a bad taste in my mouth. I might feel like vomiting. I might feel like I'm wetting my pants. But don't worry, it's not serious. None of it is serious. None of it actually happens. It's just a feeling. Okay, that it affects your feeling. So I said, okay, that sounds fair enough. So they now start pumping me with the dye, and my God, do I get in pain? I haven't had pain like that, and they said to me, you mustn't move. You're going to spoil everything if you move. Okay, and I've got both my hands behind my head in a position that is, where they can. And I had the one, they both had to be straight behind my head. And then they were doing the pumping and injection, and now now they're telling me I mustn't move. Okay, and I'm now getting this incredible pain. Okay, and they didn't tell me about any pain. Okay, so there was no, and they pumped, and I kept still, but oh my God, was it painful. Okay, eventually they stopped, and they came out, and they came on the side there, and they said, the needle came out of the vein. We never got any dye into the vein. Okay, it's all pumped into your arm, in your tissues.
Oh, goodness gracious.
And that was the pain. Okay. And they were in another room, obviously, because this is radiation. So they're sitting with screens and things like that, whatever they've got inside that room, but they weren't in the room. So they weren't monitoring whether I had pain or whether I was saying anything. And so my arm it's gone down quite a lot now, but it was just, all the liquid was there. It was like my arm, I couldn't bend my arm. It was so fat with all this liquid pumped into it. Okay. And human error. Okay. Human error. That, the 3rd doctor never got the proper vein. You think in this day and age, there's some way of just, getting it all correct quickly and easily. But it didn't happen. And they said, you know, "Oh, you were right, you were right." And they called for somebody to come and talk to me about what had happened. And while I'm lying there, and they're busy trying to patch up my arm and so on, and they apologize. They apologize. They said, you know, we haven't done it. We've got to still do it tonight. I said, "You've got two chances, my man. Okay, you've got two chances, and both of them are no. Okay, absolutely no. You've got what you need from the ultra scans. Okay, and you fouled up on this one. I'm in terrible pain. Okay, I just want to go back to the bed upstairs. Okay, where I was." And they then put me in the chair, and they said, "We've called for a porter." Okay, 10 minutes later, the porter hadn't arrived. Okay, now I'm getting pissed off. Okay, and I'm cold as hell. I mean, I arrived in a t-shirt and shorts. Okay, and the air conditioning in the hospital is really cold. Okay, and I said, you know, and there were 3 people sitting in this office over there. I said, "Don't one of you know where my room is? Why must we wait for a porter? You know, just take me back to my bed upstairs." Okay. And the one woman said, "I don't even know where to go upstairs. I've never been up there," she says. Okay. The other one says, "Well, I'll take you, but you know, I also haven't been there, but we'll ask as we go around down the passages." I mean, come on, you know, it's just like ridiculous. Okay. Anyway, they got me up to my bed, and yeah, then at that stage they'd called a surgeon that was on call. Okay, and he came to the hospital. He looked at everything and chatted to me. I actually I got on very well with the surgeon. You know, he just had a different attitude, and I think he might have actually been South African, because he said the biggest hospital in South Africa is Baragwanath, and he said he taught at Baragwanath or worked at Baragwanath. Okay, so and he said he hated every minute of it. He said the violence, humans against humans, he said it's just ridiculous. And so anyway, he said, "You know, there's some good that's come out of this." I said, "Okay, yeah." He said, "Well, first of all, you've landed up at a public hospital." He said, "If you'd gone to a private hospital, the surgeon there would already have you under the knife, okay, and charging you somewhere between $5,000 and $8,000, okay, and because that's what they do," he says, at the private hospitals. But you know, he said, "I want to look a bit more, think a bit more, and look at what the alternatives are." And we chatted about, you know, he said, "I'm going to send you home." And he says, because it's taken so many months to get to this point, I don't think we're suddenly in a dire emergency. You know, he said to me, "If it happened yesterday, then I probably would have to cut you open and put a bypass in." Okay. But it's been many months, so I think we've got time to think about and discuss with my colleagues, you know, what are alternative treatments, if there are any, or whether we have to cut you. Okay. So I said, "No, I appreciate it," and I asked him questions about, you know, what about, you know, do I walk? He said, walking and getting to that point where you're in extreme pain, he said, that's a good position to be in. Because he says now your blood is trying to get through, trying to find ways through. Okay. And, you know, let it find a way through, you know, that's, and he said, if you keep doing that, and he said, and you can then go a little further each time or whatever. He said, you know, that could be what we're looking for. Okay. And so I said, well, what are the chances of the body healing itself by me pushing it? He said 50-50. And he said, we regard 50-50 as a very good percentage. Okay. But he said, we'll come back to you now. He's now in charge of me, or his department, the surgery department, is now in charge of me. And the GP had prescribed blood thinners, blood pressure tablets, and other things, which I think they forgot to send to the pharmacist, because when I went there to go and have a look at what it was, because I wanted to first diagnose which ones they're giving me before I accepted them. And but they'd forgotten to send it through. And so I didn't have to do it. But the hospital, while I was there, said, you've got to take this pill, which is a blood thinning pill, and I'm going to prescribe you some more blood thinning pills. I said, now just explain to me what's going to happen with blood thinning pills, okay? Because I thought logically, he said, well, and because the first thing I asked him, what is, and why are you giving it to me? Okay, so I could hear his answer. He said, well, it will help the blood in the veins get through more easily to the tissues. Okay, and I said, what's causing me pain? Okay, now your arteries are causing you pain, not the brain, the veins. Okay. I said, well, what is this going to do to the arteries? He said, nothing at all. Okay. So I'm going to stay with the pain. This is not the surgeon now, this is the doctor. And he said, yeah, you stay with the pain until, the surgeons come up with a solution or a treatment from their side. And then I said, well, okay, so basically it's not going to help me. He said, yeah, it'll help in the veins a little bit. Okay. So they then discharged me. And
I would have thought that the blood thinning had something to do with reducing the risk of clotting or something too, I suppose. No? Or
well, you see, it's not the interesting thing. It's interesting that you say that as well, because my blood didn't clot. My blood wasn't, I've got a clot, okay, yes, okay, but the blood didn't clot, okay. The arteries got a buildup of different substances like plaque, and they closed and closed until the blood couldn't get through anymore, okay. That's what the clot was, okay. It wasn't that the fact that the blood was too thick, or the blood was, it had nothing to do with the blood. Okay, itself. Okay, it had to do with the walls of the artery, and then that same substance, which I guess is cholesterol. I'm only guessing, and that it went. When the veins are so much smaller and weaker than the arteries are, and so that certain veins just block up. Okay, and from my research, I know that certain veins will help other veins, and get stuff. So it's not, but also thinning it, it just keeps the flow going, in the veins, basically. That's but it's got nothing to do with the pain which comes from the artery and the main blockages which are in the arteries. So, that's my story, and. I know, sorry, I've repeated myself because I told you in the audio, but so now I've got a diagnosis, okay, and I'm happy. I've got a diagnosis, okay. I know exactly what's going on now, okay. Now I've got things to research, okay. I've now got things, and as it happened, just like the universe just opens up certain things. And so, because my first question to myself now is, why have I got blocked arteries? Okay. Okay, so I basically got blocked arteries because of, let's just call it, substances or chemicals that are in my blood that stick to the wall, okay, and, of the arteries. And so your basically your blood is unhealthy, okay. And why is my blood unhealthy? That's my next question. So that is because I am eating what I thought was good, okay, from my previous. I remember I'd healed myself for things like arthritis in the past where I couldn't walk then, okay, but that's a joint thing, an osteoarthritis, and I cured myself of those things, and came to Australia able to walk again. So I thought, I'm very serious about my diet, okay, and I know that these things don't just happen over 1 year. I know it's like a build-up, okay, but the big thing that I discovered was that despite Dr. McCullough, Dr. Gundry, Dr. X, Dr. Berg, all of them saying certain things about certain foods, okay, it's almost like they're in a team, because what I discovered now is that I should never have been eating saturated fats, okay. Whereas I was looking for saturated fats, because saturated fats come off meat mostly, okay. So you find that it's the fat on the meat, or the fat in the fish, and so on. And I would even eat my wife's fat, because she just didn't like it at all. And so for a long time now, I've been eating the fat off the meat, and that's been one of the poisons into my bloodstream. But I did that because the doctors, like I just mentioned their names, they were all advocating it, okay. So that was definitely. Then going a bit further, I've discovered a whole new, I don't know what you call it, but a whole new, let's just say, call it a location on the internet. I can't think of the right word, or information that is not out there in the public domain. It's something that it's information by really serious scientists and government departments, and first world government departments and others that have done all the research, done all the tests on thousands of people on an ongoing basis over 20 years. Okay, some of them are 50 or 60 years, and still confirmed today that the poison of eating meat is what your body can't handle. Okay, and they show why, and they show the substance. They know the scientific names of the substances that cause this, that, and the other thing. And they've got pictures of scans going back, and yet it doesn't get to the farm. It gets exposed to the pharmaceuticals, and they keep on trying to find a drug that's going to combat that particular aspect or that chemical in the meat or in the fish. Okay, and particularly the chicken. And so that's what they're trying to do, so that when people get sick because they are eating meat, that they've got a pill to give them, okay, so they can keep on eating it. So I mean, that is like I'm still waiting, obviously, because it's only Sunday now, at some stage for the surgeon to come back to me to let me know what he thinks of them. But from my purpose, I am en route to discovering a whole lot of new things that I just did not know. Okay, Now, if I don't know, okay, from my research, Mr. Average in the street doesn't know either, okay, and it's cruel. It's very, very cruel. You know, from what I've gained in the last 24 hours, as far as being aware of, you know, every doctor should be making people, the first thing they should do when they come into their room is say, sit down, now write down your whole diet, what you've been eating, what is your diet, and, you know, let's have a look, okay. And so it's not just about junk food. It's not just about burgers and pizzas and stuff like that. You know, it's about what I would have assumed was a healthy steak or a healthy chicken breast or a healthy piece of salmon, or, you know, but it's just not like that, okay. And the science is there to prove it over and over and over again. Yeah.
So what does the science say about diet then? What, vegetarianism? Is that what it's saying?
No, veganism.
Veganism. Okay.
Yeah, they don't call it vegan, okay. They call it 100% plant-based, okay. And they don't use the word vegan ever in any of the research I've done, okay. I mean, I know at this stage it's superficial, just in a short time.
So not even like honey or anything like that?
Well, I'm trying to get to that point, okay. You know, for example, you know, this morning oats was, we've got organic oats, and so, you know, we made porridge with water, and then to sweeten it, because it's very, very bland. I mean, we did have alternative sugar, but we decided we had organic honey, so we put organic honey on the porridge. Okay, I haven't got into that detail. You know, the broad detail that you know, like fruits are really good, have no effect on my diabetes. I haven't been eating fruit for years and years, okay, because of the sucrose, whatever it is. No, that's sucrose. What's in the, anyway, the sugar in the fruit, okay. Now I find out that is absolute junk, because it changes its form and has other benefits, and it doesn't influence your blood sugar levels, okay.
Fruits are very rich in water too, though, aren't they? Like they carry a huge amount of water, don't they?
Sure. And a huge amount of nutrients, okay. But the doctors I've been following have just said, you know, cut it out, okay. Cut out fruit, okay. And that's not just one. It's not, you know, it's Dr. Gundry's, Dr. McCullough, Dr. Blake, Dr. Berg, and others, okay. So, and I bought their books, you know, as well. And so it's a whole new learning curve. I've seen how people have on scans, on images, I've watched probably 4 or 5 or 6 videos coming from this sector of the people who keep making people aware of how easy it is to stay healthy, okay. And so they've you know, all the tests that the health departments have done around the world have all 100%. It's not even, you know, a percent. It's 100% of all the government departments who have gone through all the tests and things. They all talk about a plant-based diet being the healthiest. And if you get ill with something or other, immediately go onto a plant-based diet, okay? And then, you know, take whatever tablets that, but get onto that plant-based. And I've seen pictures of where the arteries were narrow, and sort of 3 or 4 months later, they're 100% white with no intervention other than going from a carnivore diet to a plant-based diet. Okay, and 100% of everybody that did it diligently and were monitored, recovered. They recovered from what I've got. Okay, and he said a plant-based immediately drops your cholesterol to acceptable levels. Okay, because the cholesterol comes from the eating of animals and fish. Okay, and your blood pressure gets down also. Not sort of the best results. The one video talked about the one doctor, and he has been like 2 weeks. Okay, but most of them talk about a few months to get down. Now, the main driver that I can understand from here historically over many decades is a Dr. Ornish, and I've listened to an hour and a half of his of a video from him. He's a very good talker, very good speaker, shall I say? Okay, so he keeps your attention, and he uses slides and images and something, and so it is good. So, and then I listened to a Dr. Campbell and some others as well, and they. Anyway, I've probably said enough now, but that's where I'm at. I'm upbeat. Okay, I'm upbeat. I really am. I don't feel down at all. Okay, I've got my diagnosis, and the universe has led me to this whole new sector that I didn't know existed. Okay, so yeah, I'm going to immediately swap over to a plant-based diet. There are things I don't know, like the question you asked about honey, and I don't know about about coffee and stuff like that. Okay, I will get it. Just I had to prepare my lessons for tomorrow, get set up, and so I had to stop today researching and how to get those classes. But I'll probably pick it up again if I can get my classes finished. Well, at least 2 more. Then the other one is for Thursday. I can do Thursdays, get set up class sometime. So then I'll get back onto looking. And the interesting thing, and I can see how this is all going to fit together very broadly, is the nanonutrients that I have on, and the Australian and South African nanotechnology. I've had a couple of long chats with Tian in South Africa, and he had similar issues to what I had a long time ago. He's younger than me. But it was because of an accident that he went through that, and he then went on to totally plant-based, and then his partner now in Australia, on the East Coast there, that is the lab assistant or something. He's been on. Also through circumstances, for 8 years, he's been on a plant-based diet as well. Okay, and so the two are partners. Okay, and they're both on plant-based diets for many years, and they want to make the world aware of how healing plant is. So they've started nanotechnologies, which is 100% plant-based, like turmeric and vitamin C and vitamin D, and all water soluble in the body too. So yeah, so I now suddenly find myself in a new world of people, and their links and they're
Mm.
people that, so I get videos from Tian, and really, moving forward.
Mm. Mm.
Sure.
And you don't feel that there's any sort of like short-term risk at the moment for you? Like you're confident that now you've got the diagnosis that you'll be able to move forward safely and everything?
If you don't mind me saying so, I think it's a very important question and to ask. And I willingly took the blood thinners on Saturday night, and I've taken the blood thinner today, and I will continue taking the blood thinner. But it's not a coincidence, I don't think, that the pharmacy never received my script from the doctor. Okay. And so that's fine. I mean, I went there with all intentions of seeing it, but it wasn't there. And they had phoned me, they'd got the pharmacy name and everything from me, and but it hadn't happened. So to answer your question, in the very short term, I don't really know what the short term is. Maybe the next month or two is short term, and but I'm convinced that in the medium term, this is the right route to go for me. Okay, it's just I would be so silly not to, because all this has been exposed to me in one day. Okay, and when the surgeon comes back to me, then that's another ball game. Okay, we'll deal with. I'm waiting for him basically to make contact.
So if like that bypass that you mentioned, like where do they do that? Like in the leg, do they?
Yeah, next to the artery. It's inside the cut, but that's just. But there's a number of arteries that got blockages. You see, now I know from my research that the science is available to also put things into your arteries and clean them out. Okay, and whether that hospital has it or hasn't got it, or maybe they do have, maybe that's one of the things he's got to consider. So it's not necessarily a bypass. Bypass is quite old in a lot of sense. They've been doing it for a long time, and usually it's around the heart somewhere. I don't, from my just awareness, that's all. But I'm going to, I've put a lot of weight around the surgeon's thing. It says, walk until you're painful. It's going to do you good. Okay. Now, before I was like, as soon as I got a bit painful, then I stopped walking altogether because I thought the pain, I might be doing myself an injury. Okay. But now I know I'm not doing myself an injury. Okay. So now I'm going out every day, and well, I will be. I have been. I went out today and pushed it. What is today? Today's Sunday. Yeah.
Sunday.
It was Friday. So I've had yesterday. Yeah. So yeah, I did. It was Friday 1 o'clock that I went in, and then spent Friday evening in the hospital. Yeah. So I pushed myself yesterday, and today it was a little worse, sore than it was yesterday. But I'm also considering things like, what type of shoes am I wearing? What type of, heels do I have in them? Because I wore different shoes on Saturday to what I did today. So that I'm going to experiment with that too. Experiment with everything. But inwardly, I think I'm going to start healing. And other than the blood thinners, which I will continue at the moment, okay? And I'm going to take this decision not to put any poison in my mouth. So it's really it's all normal.
They didn't give you a hard time at the hospital about vaccination and stuff like that?
Only one comment from the surgeon, okay, and that was, he asked me, nobody asked me, okay, never was I asked, and I went through a lot of pillars and posts, okay, but the surgeon said to me, when was your last vaccination? Okay, so I said, no, I haven't had any vaccinations. He said, that's fine, because the vaccination could have caused this as well. That was his last words on the subject. But otherwise, no, they hadn't. Yeah. Anyway, at least I know I don't have COVID, because I had to go through the test.
Yeah, well, that's all. Well, I do that every Sunday. So
yeah.
Anyway.
Yeah. But you've had the jab now. Yeah.
3 of them.
3 of them. Have you had 3? Yeah, that is good. Yeah. Okay. Yeah. Any side effects?
Not for me, no. My youngest son, with the 3rd one, he was off work for like 4 days with it. He said, he may as well have had the virus, he said.
Yeah.
He was quite sick with it. So
okay. Yeah.
But it's everywhere here at the moment. Like, what are they talking about 10,000 cases a day or something at the moment?
It's the same now. It's now large numbers, but nobody seems to be worried about it. Okay, now anymore. I don't know why. I'm not interested in finding out too much, because we basically stay at home anyway. So.
Well, that's right. So I think their attitude is that because so many people are vaccinated now, it's not going to, the risk is a lot lower or something. But then in the next breath, they say, oh, we're in for a horrible flu season this year. So
yeah.
What do you do? So
yeah.
Stay healthy, I think, is what you do, doesn't it? Keep your immune system strong.
Yeah, but I thought I was okay. And
well, it's sort of interesting just listening to your talk too, because I guess one of the things that I've been thinking about for a while, and not that I eat a lot of meat now anyway, but like when I do have a meat, it'll only just be like a small serving, like in rice or something like that, more as an addition to, rather than the core part of the meal sort of thing. But I've been thinking about the idea of even phasing that back further as well. So.
Oh, have you? Okay, that's interesting.
Yeah, and I mean, my eldest son, he is has a vegan diet, but when I sort of think about it, the main resistance I think I had to it was, which is no excuse at all, was more around, well, what will I eat?
Yeah.
Not is it the right thing to do or the wrong thing to do, or a good thing or a bad thing. It's just like, oh, well, what will I eat? Which is, as I said, no excuse at all, really. But,
it's interesting. My oldest daughter is a vegan. Okay, bringing a child up as a vegan. She was a vegetarian, and then the child was born, and so on. They both became vegans. And
well, same with Matthew. His eldest daughter. I mean, they don't stop her from having meat, but she just doesn't really like it. So.
Yeah. I don't think I'll have a problem, because in my early adult life, from about 21,
Mm.
I was a vegetarian. Okay, so that's where my oldest daughter gets it. You know, she was born when I was 22, 23, and so she grew up with it and just continued it. Okay, and so, you know, for the little time that I've in this day, in the last 2 days, it's all sorts of interesting thoughts have occurred to me, you know, and maybe it's something, if okay, maybe you and I in future can just maybe touch upon some of these thoughts, you know, and that is, you know, by being party to slaughtering animals, you know, is that not increasing violence on this planet?
For sure, for sure. There's that side of it, and I think even in the broader sense too, you know, about just about how we engage, you know, to some of those practices that we've talked about too, like, you know, having your feet in the earth and all of those sorts of things, you know, because it is clearly more than just one component. It's more than diet, it's more than exercise, and it's more than, you know, state of mind. You know, it's a range of things, and a range of things in the right combination. Now, I think is a classic case of doing the right thing in the right way, because if you can do the right thing in the wrong way and have terrible results, you know. So so I think it ultimately is about doing the right thing in the right way, and it's a matter of having some clarity about, well, what is that right thing when it comes to diet and exercise and, you know, spiritual practices and all of those things, you know. About having them in balance.
Because you know, the thought is, you know, you use the word spiritual practices, but, you know, surely what you eat is a spiritual practice. Okay?
Oh, it is. It definitely is. Yes, and there's no doubt about that. You know, and how you prepare your meals is a spiritual practice, and and how you eat your meals is a spirit. All of those things, absolutely right. You know,
So
But you know, as you rightly said, you know, plant-based and not just any plant, you know, like, because potato chips aren't, I would have thought, a good candidate, but when you talk about things like turmeric and antioxidants and those sorts of things, well, you know, intuitively it's like, well, for sure, you know.
I'm going to obviously now, probably for the rest of my life, apply my mind to it. But, you know, you just the one thing you mentioned, you say, like, potato crisps. I don't think there's anything, I'm assuming now, I don't think there's anything wrong with an organic potato. Okay.
No.
That you turn into a chip. It's the way you turn it into a chip. Okay. You know, if you're going to use saturated fats, okay,
well, that's right.
But if you use, let's say, olive oil, then you've got olive oil, which is good. You've got the potato, which could be good. There's no harm in that, surely. I'm just throwing out, I don't know the answer to that, okay, but that's my logic tells me that, okay. So
and you know, intuitively, the you know, the plant-based diet, by virtue of what it is, would mean that it's, you know, high in water content, so your hydration is probably going to be higher, and thereby flushing your system and all of those things. So,
it'd be much higher in fiber probably too. Okay. Very important. So
but one of the big, you know, contributors to, you know, the cholesterol issue, the bad cholesterols, is just taking, you know, eating psyllium husk as part of your diet, you know.
Yeah,
So
for the fiber.
yeah, I mean, I just have, you know, a couple of tablespoons in a glass of juice every morning. Have done for years and years and years. You know?
Yeah, that's great. Okay.
Yeah.
You see, but I hadn't taken the juice because I thought, oh, no good, diabetes, you know, and sugar, and you know, now sort of overnight I'm thinking, hell, that's good, you know, to have. Or I don't know, but I'm assuming that maybe you got to eat the whole fruit, maybe not juice it. I don't know. We'll see.
Well, there's juice and there's juice, isn't there? You know.
Yeah. So I guess,
and even exploring other juices like, you know, celery and beetroot and all of those sorts of things, you know. So
yeah. So
sounds good.
Yeah,
sounds good.
No, it's this is year number 9, the end of a cycle.
Well, the end of one and the start of the other. So
absolutely, and perhaps, you know, I thought it was only going to do with career, you know, but clearly it's going to do with a lot of other things too. So yeah, it's going to do with diet as well. Okay,
sounds good. Good.
Yeah, well, thanks very much.
No, that's good. And you take care, and keep that focus and awareness on regaining your health, for sure.
I will. Thanks. Okay. You stay well too. You stay well.
I will.
Okay.
Yeah, well, I'm off to the dentist tomorrow for a big long session, so that'll be interesting. But anyway, that's another story.
Okay. So. Yeah. Goodness me. Sure. I should too, but not today.
No.
Okay.
No. Okay. Talk to you on Wednesday.
Okay, Dan. Cheers, man.
Okay.
Bye.